In today's class, we will study hepatoprotective drugs. This is one of the topic in the pharmacology. Now, the term hepatoprotective. If you split the word hepatoprotective drugs, this hepa means liver, and hepa means liver. Protective means for protecting the damage of the liver. This is the meaning of the hepatoprotective. Hepato means liver, protecting the from the damage. Now, what it means, the hepatoprotective drugs or the agents that protect the liver cell from the injury and helps to maintain the normal functions. It means that whenever if you give these drugs are the agents that protect liver cell from the injury. Different due to the so many reasons the liver cells become injured. It will protect and as well as help to the maintain normal function. All the whatever the functions of the livers are there, these drugs help for the maintenance of the normal functions. The main function is of the liver is the metabolism as well as the detoxifications as well as producing the bile in the body and so many other functions also there. These drugs are helpful for the promoting for the normal functioning of the liver. Now the next thing is the definition of the hepatoprotective drugs. Here hepatoprotective drugs are the substance that prevents the liver damage. First thing is these drugs prevents the liver damage. Next is the promote regeneration of hepatocytes. Third one is the improve liver functions. Simple meaning these drugs doing three functions. The first one is the prevent the liver damage due to so many causes. If the liver is damaged, then it prevents the liver damage. Second one is the promote regeneration of the hepatocyte. Hepatocytes is nothing but the cells of the livers are called hepatocytes. That is the liver cells itself become repair. The one of the power in the liver is that itself is regenerating and repair itself. This is the main function here of the liver. These drugs promote the regenerating again it is generating the hepatocyte. If you give these drugs will helpful for the promoting or become speed the regeneration of the hepatocyte or liver cells. Third one is the improve liver function. So whatever the functions of the livers are there, that is increase the or improve the liver function. These three functions they are doing the hepatoprotective drugs. If you give these drugs, the first thing is the prevent the liver damage. Second is the promote regeneration of the hepatocyte. Third one is the improve liver function. This is called hepatoprotective drugs. The next one, mechanism of actions, that is called MOA. The simple meaning how these drugs are doing actions, mechanism of actions. The first thing is the stabilize the hepatocytes membranes. If you give these drugs, hepatoprotective drugs, then first thing it is doing the mechanism of action is it stabilize the liver cells or membrane. The liver cells or membrane, it will become strong or stabilize. It will prevent the toxic things or going inside the liver, the unnecessary things. They stabilize and protect. The first main mechanism of action. The second is the acts as antioxidants. If you give these drugs, it prevents the oxidation. This is acts as antioxidants and reduce free radical damage. It is preventing the free radical damage. This is the second function. Next one is the promote regeneration of liver cell. Just now I told the liver is one of the biggest organ in the our body. This is the, if you give these drugs, that is whatever the cells are damaged, that is regenerating, again growing. This is the promotes these drugs regenerating the liver cells. As well as next is the improved detoxification of the functions of the liver. The main function is also it is, if you give these drugs, the detoxification increases. The next one, prevent the fatty degeneration. That is the whenever if you are taking continuous fatty foods, then the fatty liver it will give these drugs, it prevents the fatty degeneration of the liver. The next one is the fibrosis. Fibrosis means whenever the liver cell is damaged or it is not repairable, in that cases it become hard. That hard cells are called as a fibrosis. Liver become fibrose, it becomes hard. These drugs helpful for the prevent the fibrosis of the liver. In some cases, the liver damaged, cells are damaged, it prevents the fibrosis. This is the main mechanism of action of the liver cells. The next thing is the classification of the hepatoprotective drugs. The hepatoprotective drugs are mainly classified into two types. One is the herbal drugs, another one is the synthetic drugs. Herbal drugs are natural drugs or the herbs or Ayurvedic drugs. Second one, synthetic drugs. These are prepared in the labs or chemicals. The herbal drugs is again we are dividing into two types. One is the single herb, another in the combination of the herbs. The single drugs, single herbs are very common. That single alone it is helpful for the preventing so many liver diseases. Very commonly we are using Picrosia kuru, Katuki, Bhumiamlaki, kalamegha, Bringraja, and Punarnava, Yashti Madhu, and as well as the Silymarin. These are the single drugs we are giving for the treating the liver damage. The second one, polyherbal preparation, the commonly in the available pharmacy or medical shop, the polyherbal preparation is available. Very famous brand is Liv 52, Livogen, Liverol. These are the famous brands are available. Those are polyherbal. It means the multiple herbs are included in one drug. This is the polyherbal preparation. Now the second one is the synthetic drugs or the allopathic drugs. Here the synthetic drugs or modern drugs, those are again divided into four types. One is the bile acid synthetic drug, second one is the antioxidant synthetic drug, next one is the LOLA, and fourth one is the essential phospholipids. These are the four types of the synthetic drugs. Now we'll study one by one. The first one is the bile acids. Bile acid, here bile acid, the common hepatoprotective drugs we are using the UDCA. UDCA is the common drugs, that is in short we are calling UDA. The main one is the ursodeoxycholic acid. This is the, in short it is called as a UDCA, ursodeoxycholic acid. This is a very famous brand in the market. That is a Udiliv 300 mg, Udiliv 150 mg. It is commonly almost all the physicians prescribing Udiliv. This drug is helpful improve the bile flow. Whatever the main function is, the liver is the bile pigment or bile is producing. Here if you give this drug UDCA or Udiliv drugs, improve the bile flow. These drugs improve. Second one is the dissolve the gallstones. The cholelithiasis or gallstones, it is produced in the gallbladder. If you give this UDCA or Udiliv tablet, it dissolves the gallstones. This is one of the main therapeutical indications of this class of the drug. The next one is the antioxidant. Antioxidant here again, that is the NAC, vitamin E, vitamin C. These acts as a antioxidants, prevents the oxidation in the body, prevents the agings. The very common we are giving NACA. This is called as a N-acetylcysteines. Very famous brand is Mucinex. It is very commonly used in the for the corona disease also, because it is a mucolytic agent, as well as it is using as a antioxidant also. It is also preventing the acting as a hepatoprotective drugs. This is called NAC. Main function of the here NACA is the increase the glutathione. Glutathione is one of the strong antioxidant. This is one of the strong antioxidant. If you give this class of the drugs, it increases the glutathione in the body. The next one is the LOLA. It is also one of the synthetic drugs. This one is the L-ornithines L-aspirate. This is called L-ornithine L-aspirate is called as a LOLA. The very famous brand is Hepamers tablet, Hepamers injection. In almost all physicians prescribing in the liver damage or in the liver diseases, LOLA, L-ornithine L-aspirate. This Hepamers main indication is what, whenever the liver is damaged in our blood, the ammonia is increases. If you give Hepamers or LOLA drugs, these drugs are decreasing the ammonia, prevent the damage of the cerebrum, because if you goes the ammonia to the brain, the patient goes to the shock or patient become unconscious. These drugs, this class of the drugs prevents the decrease the ammonia and preventing the, due to the liver damage, it prevents the shock or unconsciousness. The next one is the essential phospholipid. This is the fourth one in the synthetic drug, fourth one. These class of the drugs are repair the hepatocyte membranes. Whenever the hepatocytes, that the liver cell membrane is damaged or it is become not clear, in that cases it helpful for the repairing the hepatocyte membrane. Due to that, these drugs acts as a hepatoprotective. This is the fourth class essential phospholipid. In simple meaning, the bile acids, antioxidants, LOLA, as well as essential phospholipid, these four drugs are coming under the synthetic drugs. The next is the therapeutical uses, or in simples, the indications in which diseases we are prescribing hepatoprotective drugs. The very commonly we are prescribing drug induced liver damage. You know, that is due to the so many reasons, due to the excessive use of paracetamol or dolo tablet, dolo 650, or else analgesics, or else antibiotics. If you are for a long time, if you are using, then the liver damage, these class of the drugs induces liver damage. It means that preventing the liver damage. The next one, alcoholic liver diseases. The patient is continuously consuming the liver due to the liver damage. These class of the drugs, the treating the liver, alcoholic liver disease. Next one is the fatty liver diseases. Due to the excessive use of non-vegetarian food or fat or oily things, the fatty liver content is increases. In that cases also, these class of the drug, fatty liver diseases, it is using. Next is the chronic hepatitis, you know, hepatitis B, hepatitis C, and so many other hepatitis A. All that cases, the common drugs we are using, Liu52 or Hepamers, Udiliv, these in the hepatitis, chronic hepatitis, these class of the drugs we are using. Liver cirrhosis, it is one of the chronic case. The liver become the cirrhosed. In that cases also, we are giving hepatoprotective drugs. Next one is the cholestatic liver diseases. What happened here? Due to the bile pigment or bile is obstructed. Due to that, the bile is excess of the biles comes in the blood, throughout the blood. In the due to that, the patient is suffering from the jaundice. In that, jaundice is also coming under the condition that is cholestatic liver diseases. In that cases, jaundice also, the hepatoprotective drugs we are using. This is about the indication. Next one is the adverse effect. What happened if you are taking continuous for long times? Any adverse effect? Generally, there is no such adverse effect. The mild cases may be nausea, vomiting, diarrhea, abdominal discomfort, allergic reaction also very rare. These are the adverse effect. Now, what are the advantages of taking these hepatoprotective drugs? They mainly promote liver cell from the toxins. These class of the drugs promotes the liver cells from the toxins. Next one is the promote liver regeneration. You know, that is the liver itself is cells are regenerating. This class of the drug promotes the liver regeneration. Next one is the improve liver function. So whatever the functions of the liver, these class of the drugs improving. Next one is the it acts as an antioxidant or prevent the aging. These are the advantages of the hepatoprotective drugs. The next one, disadvantage of hepatoprotective drugs. Here the many herbal preparation lack of strong clinical evidence, because the so many herbal products are not having evidence, or there is a no ABM, no evidence based medicines. They are not preparing according to the their whatever the rules, regulation, guidelines you were given. That's why it is very difficult for considering the so many herbal drugs, considering in the hepatoprotective drugs. The next one, do not completely reverse the advanced cirrhosis. If the patient is suffering from the advanced cirrhosis, it may be 80% damage, 90% liver damage. In that cases also do not completely reverse, because it is in the for chronic cases it is very difficult. This class of the drug is preventing more than 80 or 90% liver damage. Next one is often used as a adjuvant therapy. If some main treatment is going on, in that cases along with supplement, these drugs also they are using instead of the main drug. Next one is the common brands in the India. Very famous brands or common brands, doctors or physicians prescribing this class of the drugs, hepatoprotective drugs. Very commonly, the almost all the Ayurvedic, allopathy, all the physicians practitioner prescribing is the Liu52 drugs. Those are coming in tablet form, syrup form or drop form, Liv 52. Next one, Udiliv tablet, just now I told, which is one of the famous for the cholelithiasis, gallstones, dissolving the gallstones by increasing the flow of blood flow, Udiliv tablet. And next one, Hepamers, just now I told, this is a very famous brand for decreasing ammonia, as well as that is the Levigraph as well as essential N injection. These are the injections we are using as a hepatoprotective. Other so many brands are there, only few brands are taken as an example. Okay, hope you understood today's class. If you understood, please like and comments if you want some more videos, and share to your classmates. Thank you for watching. Please like, share and subscribe.